cause of this cardiac arrest contributed to this, it would be, one of the diagnoses that could potentially explain what happened. And what commotio cordis is it's a type of very rare cardiac arrest that occurs due to blunt, non-penetrable trauma to the chest wall, directly over the heart, and it leads to a chaotic and life-threatening abnormal heart rhythm called ventricular fibrillation. It mostly does occur in sports, either at the competitive or recreational level, and it's usually due to a hard, projectile object, a baseball usually, or a hockey puck, or even a lacrosse ball that strikes the chest directly over that heart at the exact time of the cardiac cycle when the heart's vulnerable for, believe it or not, 20 to 30 milliseconds for this life-threatening arrhythmia to occur. It's got to be at that exact right velocity, creating this perfect storm, if you will. It can also be seen in sports that involve more physical body contact, like football or rugby or even karate, but it's even rarer in these sports. What's also very rare is to have something like this when you're over 20 years old. It tends to occur mostly in young males. That's our average age that we've seen in our registry database of 15 years old, when the chest wall and the ribs are still developing and hardening.
And what is a cardiac arrest? And, a lot of people hear cardiac arrest and they think heart attack, but the two are completely different.
You're absolutely right, and I think that's very important to kind of explain. So even though, like you said, these terms are often used interchangeably, they're actually very different. So cardiac arrest is when the heart suddenly and unexpectedly stops beating, and it usually occurs due to the development of a chaotic electrical rhythm of the heart. So it's more of an electrical issue, whereas a heart attack is a sudden lack of blood flow to the heart muscle itself due to a blockage of an artery that supplies the heart. So this is more of like a circulation or plumbing problem, if you will.
Doctor, there's been a couple of silver linings from this, especially with Damar Hamlin, by all accounts, recovering well, and his prognosis looks good. But one of them is a lot of people are pushing for people to get certified with CPR, and I understand that the Bills assistant trainer who gave Damar Hamlin CPR right at the get-go played an important part in both his recovery, and not just physically, but maybe cognitively. Can you explain that a little bit?
Yeah, absolutely. I think that is of the utmost importance. The emergency medical staff was phenomenal. I mean, they truly did save his life. They first and foremost recognized that we have a collapsed athlete and this is a cardiac arrest. They immediately activated emergency medical services, being on the field. Reports are that within seconds they were there, started immediate CPR, and led to early defibrillation to shock him out of this life-threatening arrhythmia. It is of absolute importance, and I can't stress that enough, that CPR played a huge role in this. The credit completely goes to the medical staff. I mean, they were phenomenal. And as far as the time that he was down, and there's been reports of him being down up to 9 minutes. So that's actually 9 minutes of really not getting proper perfusion to the vital organs, such as the brain and the heart. And so the faster we can start the CPR and deliver that shock to get him out of this life-threatening arrhythmia, gives him the best chance of survival. And we've seen this over and over and over again.
I mean, I got to tell you, they talk about guys that are either married to or dating a woman that's much better looking than him. It's like you're over your skis. Yeah. From a intelligence standpoint, that interview was going swimmingly, and we sounded really smart. We were over our skis.
I think that's the first time a doctor had ever said, "You know what? You're absolutely right."
I mean, you were asking questions, and I'm like, "Oh, that's a really intelligent question, Justin." I'm going to say that's a first. That's 2023.
New year, new questions.
That's too bad. And I really wanted to ask him, so he's a diplomat of the Certification Board of Nuclear Cardiology. Yeah. And I want to know what nuclear cardiology is.
Well, let's get him on the phone.
Yeah.
All right, so we're going to take a quick break. We're going to get him back on. We're going to finish up hour number 2 with Dr. Alfred Danielian here on ESPN Tucson. We were talking with Dr. Alfred Danielian, who's Director of Cardiology at Las Vegas Heart Associates. We were talking about a lot of just very informative things about what's going on with Buffalo Bills safety Damar Hamlin as he continues his road to recovery after going into cardiac arrest on Monday Night Football. I think we got Doctor on line 1. Dr. Danielian, are you there?
I sure am. Yes, thank you.
Great. Appreciate your time. Appreciate your patience. Sorry for the little technical difficulties there, but I asked you before you got cut off there, the road to recovery for Damar Hamlin. After being in critical condition for the first couple of days, having to use a ventilator, and then now is able to breathe on his own, is able to respond and touch and open up his eyes and talk. What can you tell us from your experience, what it's like for him to overcome something like this?
I think the recovery process has been phenomenal, and actually even much better than we expected with the amount of time he was down. So we are all ecstatic. I think the prayers have been phenomenal, and that everything has been working great. He literally, like you said, went from this critical state, lack of oxygen blood flow to his body, to his brain, for 9 minutes, and now, like you said, he's cognitively intact, neurologically intact, breathing tube is out, he's talking, and again, not being at the bedside to know exactly the details of what's going on, but in my experience, this is actually a very good sign. I believe at this point in time his prognosis is looking really good, to be honest, and so we are just thrilled for him.
Doctor, for all our listeners out there, since we're speaking about the heart, what are 1, 2, 3 things that people should really consider doing to have a healthy heart?
So I think the most important thing that I like to say, 2 things that we can really, really do on our end are to adhere to a really heart-healthy diet and lifestyle. So we're talking about routine physical activity and exercise, working on really keeping our weight controlled, exercising, increasing our cardiovascular fitness. And number 2, not smoking. Now, we know there's always an underlying genetic component in things, but if we can do those 2 things, we're really ahead of the game, and we can combat as much as possible and delay, hopefully, and not allow any type of genetic predisposition of disease happening.
One of the questions that I have here to ask you, Dr. Danielian, is what is an AED? What can you tell us what an AED is?
So a very good question, because I know it's been used a lot. So AED is an automated external defibrillator. So what that is it's a portable electronic device that automatically diagnoses life-threatening cardiac arrhythmias that I had referred to earlier, such as ventricular fibrillation or pulseless ventricular tachycardia, and it's able to treat them through a defibrillation, which is basically delivering electricity to stop the life-threatening arrhythmia, what we refer to commonly as a shock of the heart, to allow the heart to reestablish its normal rhythm.
Doctor, we tried something different with your interview today, which was actually do a little research before you came on. And I see on your bio that you're a diplomat of the Certification Board of Nuclear Cardiology, and that sounds like something out of a Tom Clancy novel. Can you tell us what nuclear cardiology is?
Of all the things, that's what you picked, right?
Yeah.
It's just a fancy way of saying that I'm a board-certified cardiologist to read nuclear stress tests, which is basically a stress test that involves nuclear imaging to give it more accuracy in the stress test study.
Okay, so my theory was we're going to have a doctor on this also secretly working for the CIA. That is totally wrong.
He's not working for the CIA.
As far as you know, yeah.
Real quick, Doctor, for anyone who sees someone goes into cardiac arrest or is having issues breathing and they need to learn CPR, and if sometimes you're going to be put in a situation like that. If one were to learn CPR, where can they go?
Right. I think a great question again, because I stressed earlier, CPR is of utmost importance. And my personal favorite website and my favorite go-to is the American Heart Association. CPR.heart.org is something very easy to type in there, and you'll find CPR AED courses offered through the American Heart Association. They offer in-person and online courses, as well as step-by-step instructions for those that are simply looking for a refresher or those looking to be certified. But I did also want to stress the importance of hands-only CPR. And just for those that aren't aware of that that can be done by anybody. It's simple. It's easy to remember. It's basically CPR without doing any mouth-to-mouth breaths. And it can really be done by anyone to save a teen or adult that has collapsed. And all it entails is calling 911 right away and pushing hard and fast in the center of a person's chest who's collapsed.
Dr. Alfred Danielian joining Spears and Ali on ESPN Tucson. Dr. Danielian is the director of cardiology at Las Vegas Heart Associates, expert providing some expertise on what happened with Damar Hamlin, the Buffalo Bills safety who remains in a hospital in Cincinnati but making substantial improvement. FaceTime the Buffalo Bills earlier today. So great signs there out of Damar Hamlin. And Dr. Danielian, this was a great interview. We appreciate your time. Thank you once again for joining us today.
You really upped our game
so
from
much.
an intelligence standpoint, Doctor. I mean, by a lot.
I really appreciate you guys. Thank you so much for having me on.
Happy New Year.
Have a good New Year.
Happy New Year as well. Take care.